The tongue is composed of intrinsic and extrinsic muscles. The muscle on each side are separated by the dense fibrous midline band. The intrinsic muscle from superficial to deep are superior longitudinal, transverse, vertical, and inferior longitudinal muscles, while the extrinsic muscle from top to bottom are palatoglossal, styloglossus, Hyoglossus, and Genioglossus is inferior muscle. So this is the sequence from top to bottom. These four extrinsic muscle of the tongue originating from the outside of the tongue and inserting within the substance of the tongue. These muscle are paired muscle which move the main body of the tongue. Now origin and insertion. Superior longitudinal muscle arises from lingual septum, submucous fibrous layer, insert on the margin of the tongue. It elevates the side and tip of the tongue. It also shortens the tongue. Inferior longitudinal muscle. It arises from body of the hyoid and base of the tongue. It insert on the apex of the tongue on the inferior border. It curls tip inferiorly and shorten the tongue. Transverse muscle, which arises from lingual septum, insert on the submucous fibrous layer. It narrow and lengthen the tongue. Vertical muscle, which is arises from superior surface of the tongue, insertion on the inferior surface of the tongue. It flatten and broaden the tongue. Extrinsic muscle, Genioglossus, which arises from the mental span of the mandible, insert on the lateral or inferior tongue, which depress and protrude the tongue. Hyoglossus muscle, which origin from the body in greater horn of the hyoid, insertion on lateral or inferior surface of the tongue, which also depress the tongue but it retract the tongue. Styloglossus, which arises from the stylohyoid or styloid complex, and it insert on the lateral or inferior surface of the tongue, which also retract the tongue. Palatoglossus, which arises from the palatine aponeurosis, insert on the lateral tongue and it's elevate the posterior part of the tongue. So these are the extrinsic muscle of the tongue. All tongue muscle are innervated by hypoglossus nerve apart from palatoglossus, which is supplied by the pharyngeal plexus. Vascular supply of the tongue is mainly by the lingual artery. The artery has been divided into four segments. First segment is original segment. Second is the segment within the hyoglossus muscle. Third one is the ascending segment, and fourth one is the horizontal segment. The original segment consists of root of the lingual artery, which ascends medially, then descends anteriorly. It consistently lies 3 to 4 mm superolateral to the greater horn of the hyoid bone. This artery is encountered when you are skeletonizing the greater horn of the hyoid bone deep to the hyoglossus muscle. Second segment is the segment within the hyoglossus, which passes obliquely from posterior superiorly to anteroinferiorly under the posterior border of the hyoglossus muscle and medial to the hyoglossal nerve, which enter in the intrinsic muscle of the tongue and runs lateral to the genioglossus. The dorsal lingual artery is the first branch of lingual artery which arises from this segment approximately zero point 0.7 centimeter from the anterior border of the hyoglossus. The vascular territory of dorsal lingual artery stretches from the root of the tongue 5 mm behind the terminal sulcus and to the glossoepiglottic folds and glossopalatine arch up to the epiglottis. Third segment is the ascending segment which ascend in the tortuous manner along the anterior border of the hyoglossus. The sublingual artery arises about 0.8 centimeter above the hyoid bone at the origin of ascending segment passing forward between the genioglossus and the sublingual gland. The vascular territory of the sublingual artery includes ventral surface of the tongue, anterior and lateral floor of the mouth, and the vestibular or lingual gum. And last and fourth part is the horizontal segment of lingual artery become the deep lingual artery which runs forward, upward, downward between the longitudinal muscle of the tongue and the genioglossus, extending up to 1 centimeter from the tip of the tongue. The vascular distribution include dorsal side of the tongue, lateral side of the tongue, and part of the ventral surface.